A dental implant is a fixture which is anchored in the bone, in the jawbone, where you have missing teeth, and taking support from this fixture, you fix the missing tooth on top. So this fixture is usually made of titanium. To be very specific, it's made of grade 5 titanium, which is supposed to be very biocompatible. It's extremely friendly with the bone and the soft tissue. The crown which comes on top is generally made of zirconium, which is the final crown which we provide. I would say almost 99% of people are good candidates for dental implants, because for me, I practice corticobasal implantology, which really works well with most patients. There are a certain number of patients who are not suitable for being taken up for dental implants. They are mostly people who are medically compromised. They are uncontrolled diabetic patients, or they have extreme osteoporosis. Smokers are also not good candidates for dental implants. So we generally recommend smokers to stop smoking when the active treatment phase is on. So such patients are not ideal patients for dental implants. The first step, do the imaging. That is, we have the digital OPG X-ray, which gives you a two-dimensional picture of the upper and lower jaw and the existing teeth. And we also do a 3D X-ray called the CBCT, in which you can literally walk around each tooth, and we are able to assess the quality of bone, quantity of bone, and the contours of bone. All these can be determined through the CBCT. This helps us do a proper plan. So based on the OPG and CBCT, we decide which are the teeth to be extracted. Now, simultaneously, we also request the patients to get their blood tests done, so that we are able to confirm that they are physically fit to undergo the procedure. At times, we recommend they go to their physician, or we recommend to a physician who is attached to our center. They evaluate the patient to confirm that they are fit to undergo the implant procedures. And once the treatment plan is prepared, then we fix the appointment for the procedure. Generally, we do the procedures in 3 to 4 days from start to finish. That is, on the first day, if there are extractions to be done, we do the extractions and then immediately place implants under local anesthesia. We make the impressions, and there are a few steps called the frame trials and metal trials and things like that. And within 3 to 4 days, the teeth are fixed. We ensure that the patient starts chewing properly by the end of the 4th day. We also make post-treatment X-rays, OPG and CBCT X-rays, and then we take the patient through the bite checks for over a period of 10 days, and we finish the treatment there. But very often, we request the patients to come back after a year for a review, and there are situations where we provide interim crowns in the first phase, because we expect a lot of shrinkage of the gum and bone to happen around the implants, and therefore there will be a little bit of shrinkage of the gum and bone. So there are situations where we have to change the crowns to make them permanent after a year. There can be intraoperative difficulties, or you may call them intraoperative complications, but we clearly analyze the situation, we analyze the patient before we take them up for the procedures, so we don't really encounter any of these complications. If at all we encounter some kind of complication like bleeding or post-operative pain and things like that, we are all geared to handle all those difficulties which we are likely to encounter. And in the long term, the patient only has benefits, because they are able to have fixed teeth in their mouth, they are able to chew properly, they are able to smile, speak, and go about their normal day-to-day activities without any difficulty. Coming to maintenance of dental implants, I use an analogy. I say, you've bought a car, and the car has got the axles and the tires. So here, the axles are the dental implants and the tires are the teeth which are mounted on top. Depending on the way you drive your car, the tires get worn out. So if you drive in a proper way, if you drive at optimal speeds, and if you don't go into gutters, or if you don't jump over stones and rough patches, then your tires will last much longer. So likewise, your teeth will last longer if you take care of them properly, and if you chew properly, you will be able to maintain your teeth in the long run. You have to report for the bite adjustments. We request our patients to be available once a year at least for the bite adjustments. So then things move pretty well, the crowns last long. If you go on with worn out crowns for a long time, then that can affect the integrity of the implants. So it's very important for you to report for maintenance after you've got implants done. In our center, we have cases which have survived 16 years of implants. It's about 16 years since we've started doing corticobasal implants. So we have 16 years of documentation. My mentors from Germany and from Switzerland, they have documented cases of more than 55, 60 years. So you can imagine. So that's the kind of longevity you can expect if you are able to maintain your implant supported teeth well. Generally, dental implants can be classified into two. One is the delayed loading and the other is the immediate loading. So the conventional implants which most practitioners employ are coming under the delayed loading category. The implants are placed employing an open surgery and the implants are left to heal and osseointegrate with bone, and after 3 months they reopen through a second procedure, and then they fix the abutment and then they fix the final crown. And there are situations where you have to do bone grafting, where there is lack of bone, then you do the bone grafting and then wait for another 6 months before you load the crown. But I practice immediate loading corticobasal implants where we fix the teeth within 3 days. So that's why we call it immediate loading. And even in situations where there is lack of bone, we anchor these implants deep down in the cortical bone or the basal bone, which is why we call them corticobasal implants. By taking support from the basal bone, we are able to overcome the disadvantage of not having bone at the crestal level, and then finally we fix the teeth on top, and we are able to provide the fixed teeth on top of the implants within 3 days, even in those patients who seem to have lack of bone. So that is a huge advantage. Most of these implants are placed employing keyhole procedures, so there is no open surgery involved, and therefore patients recover pretty fast after the implant surgery. We call it immediate functional loading so that the patient is able to function with the implants and teeth in place within 72 hours. So corticobasal implants definitely offer an excellent solution for patients who miss teeth or who have multiple dental issues necessitating extractions of teeth or removal of bone and teeth and things like that, and even in patients who've lost teeth because of accidents. In all these patients, corticobasal implants offer an excellent alternative, and we are able to provide fixed teeth on these implants within 72 hours. That's the beauty.